So the respiratory system is made up of what organs? So the first one you probably think of is the lungs. So the lungs are the major respiratory organs. And I guess the only other organs of the respiratory system are those that deliver air to the lungs, right? So when you think about functions of the respiratory system, I guess the primary function, if not just about the only function, there are a few here that are not vital, but the vital functions of the respiratory system are to bring oxygen into the blood, right? So we know that all our cells need oxygen, so where does that oxygen come from? The environment, so that has to get from, the oxygen has to get from the environment into our body so it can be delivered to the cells. Okay, and also there's another gas, CO2, right? And where does CO2 come from? CO2 comes from the cells. What cells? All the body cells, right? So all the body cells that make ATP also make CO2. The body cells need need ATP, but the CO2 is waste material that the cells have to get rid of. So the cells get rid of CO2. How? How do the body cells get rid of CO2? I heard one little voice over there somewhere. Through the capillaries, right? So the CO2 from the cells enters the capillaries. That's how it gets into the blood. And then where does the CO2 go? Then it goes to the lungs. And what happens in the lungs? So that gas exchange occurs. So CO2 leaves the blood, goes into the lungs, and we exhale to get rid of the CO2. Okay, I think you all pretty much have it now. Okay, another, again, so those are the primary functions of the respiratory system, the vital ones. The respiratory system, when we include the other organs and structures that make up the respiratory system, we'll recognize that the system brings odorants to the nose and vibrates the vocal cords for speech. So the respiratory system allows for speech and our ability to smell. Okay, and I meant to change this somewhat. Yeah, let me go ahead and do that. I left out something here. It should be nasal cavity. And this is one I just added. So if you all have the slides, this is not on there. I usually write this on the board, but I figured I'd go ahead and put it on the slides. So you'll have that. So the path of air. So we had the path of blood. Now we have the path of air through the respiratory system. So how does air come into the body? Through the nose, right? So the nostrils, also the mouth, but that's not really considered part of the respiratory system, the oral cavity. So the nose, the nostrils, the nasal cavity. And if you look at the picture, just follow the path. So the air goes through the nasal cavity and down to the posterior of the nasal cavity is the pharynx. And then, what's next? The larynx. What about the esophagus? Okay, so that's another pipe. That's the pipe for food. So we have two pipes, one for air and one for food. So the air, after leaving the pharynx, air goes into the larynx, and we'll see that there's a path of food through the digestive tract that you all are going to have to know also. But that path includes the pharynx and then the esophagus. Okay, so from the pharynx to the larynx, trachea, bronchi, bronchioles, and then to the alveoli of the lungs. So that is the path of air through the respiratory system to the lungs. And we'll look at some of the features of each of those structures. All right, so phases of respiration. Be familiar with these phases. And the phases are pulmonary ventilation, and that is bringing air again into the lungs. And then there's external exchange of gas, external gas exchange, and internal gas exchange. So what is the difference? External gas exchange refers to the exchange between the lungs and the blood. Internal exchange is the exchange between the blood and the body tissues. So why do you think one is called external? Why would the exchange between the lungs and the blood be external? Exactly, because the gas, the oxygen, is coming from outside of the body. Okay? And CO2 is delivered to the lungs, which takes it outside of the body. At the tissues, all of that is internal, okay, inside of the body. Okay. So in this picture, kind of looks familiar to you. So you can see that there are differences in colors, again, in the various blood vessels. So what you see here, let's follow the path from the right side of the heart. So the right side of the heart, again, contains, the picture here shows that it's blue. The blood is blue. So that means it's CO2 rich. Okay, so the CO2 rich blood goes where? From the right side of the heart? So through the pulmonary circuit to the lungs, right? And as that blood goes through the lungs, think of it as the blood is dumping off something at the lungs. What is the blood dumping off? Blood is dumping off CO2, which exits through the lungs, the alveoli. And as blood proceeds through the lungs, it's picking up oxygen. So when the blood leaves the lungs, now it's going to be oxygen rich instead of CO2 rich. And where does that oxygen rich blood go from the lungs? Before the tissues. To the heart first. To what side of the heart? To the left side of the heart. So you can see the oxygen rich blood returning from the lungs, and it goes to the left atrium and ventricle, and from there it is pumped throughout the body, okay, to all the body tissues. So you can see here the blood going below the heart to the lower extremities, the body cells of the trunk and lower limbs. And then what about the upper part of the body, the head, the body cells of the head and upper limbs? So you just have all these areas where the capillaries are providing oxygen to the tissues. All right, so the structures, you have the airways, which are passageways through which air travels to the lungs. And then once the air gets to the lungs, then the oxygen is absorbed into the bloodstream, and carbon dioxide is eliminated from the bloodstream to the lungs and to the air. All right, so this is another picture similar to the one before. Actually, maybe just the same. But again, it's showing you the conduction division. And I don't think, let's go back here for a second. I went over this yesterday, and I don't remember seeing anything about upper and lower respiratory tract. So you've heard of an upper respiratory infection? What is that? Right, so it's where the inflammation or infection is where? Right, from the neck up, right. So the parts of the path that are in the neck and above. And really, the larynx is the dividing point. So So above the larynx is considered upper respiratory. Below the larynx is considered lower respiratory. So if someone has bronchitis, what is that? That's the lower, right. So that would be in the bronchi. Or if they have pneumonia, that's the lower respiratory. Pharyngitis, upper, and laryngitis, upper. So that's kind of that dividing point. And then sinus infections and things like that. Just wanted to make sure you all knew that. And also, the respiratory system has a conducting division and a respiratory division. The conducting division includes all of the structures that are just passageways of air, which is pretty much all of it. Okay, so all of these are just passageways for air to travel. So they are the conducting division. When you get to the alveoli, that's where the gas exchange occurs, so that's called the respiratory division. It's upper. Okay, so conduction that conducts air into the lungs. That's what made me think of the conducting division. Okay, so these are part of the conducting division. And also in the conducting zone, remember from Biology 201, the tissue, the epithelial tissue that is called pseudostratified ciliated columnar epithelium. Remember that? What was the feature of it? Why was it called pseudostratified? You don't remember? Something like that. So stratified means more than one layer, right? Right. So remember, simple is the difference with simple versus stratified. What's the difference? Simple has one layer of cells. Stratified has several layers of cells. So what does pseudostratified mean? So the pseudo part means false. So false stratified. So that means it looks stratified, but it's really not, because it's really just one layer of cells. Okay. So the pseudostratified epithelium has cilia. The cells have cilia on the surface, and it also has goblet cells which produce mucus. So in our respiratory tract, why is this setup important? Right. So when we inhale, I mean, there's, as we said, dust all around us all the time. So when the dust comes through the respiratory tract, quite a few of those particles, probably most of the particles, are going to be trapped in this thick, sticky mucus, first of all. And then the cilia, their job is to push the mucus up to the throat so it doesn't get down into the lungs and maybe set up infection. So, yeah, definitely. Okay, so that is why that's important. And there are some disorders where this setup doesn't work quite well. Sometimes the mucus that is secreted is too thick, so the cilia are not able to push the mucus forward. Okay, and that's what happens in cystic fibrosis. Y'all heard of that? So people with cystic fibrosis, there's also a saline layer here. It's kind of a watery liquid here, and they're not able to produce that saline liquid, so the mucus is too thick and it just weighs down on the cilia. So people with cystic fibrosis, since the cilia are not working, they get a lot of respiratory infections because a lot of the debris gets down to the lungs. Okay. Among other problems. All right, so these are just going through each area of the path and giving some of the functions and some characteristics. So the nasal cavity contains mucous membranes, which produce mucus, filters foreign bodies, and warms and moistens the air. The pharynx, and pharynx, everybody say pharynx. Pharynx. One, how many syllables? 2 or 3? Look at the word. Pronounce it the way it's spelled. But most people say pharynx. It's not pharynx. There's no I after the N, so it's not pharynx. It's pharynx. Pharynx. Sometimes if you say it fast, it still sounds like that. There's 3 syllables, but it's pharynx. And larynx. Kind of hard to change, huh? I thought the same thing. I had been saying pharynx since I was young and got corrected in grad school. So I wanted to share that with you also. Pharynx. The pharynx has 3 parts. It has a nasopharynx, oral, and laryngeal pharynx. And all of those are still part of the pharynx. So the pharynx is like the posterior portion of the nasal cavity and oral cavity. And it's just divided into those 3 parts. Something else that is noticeable here is the epiglottis. You all should be familiar with that, why that is important. And the epiglottis is, if you look at the shape of it, it's made of cartilage and it folds backward when we swallow. So if you look at the picture, just imagine this guy swallowing something. Whatever he swallows is trying to get to what area? To the esophagus, right? So if he swallows, what's to keep it from the food from getting into the larynx? Right. So the epiglottis folds down to cover the opening into the larynx, and so that's going to prevent the food from getting in the airway and causing you not to be able to get air through. Okay, so it allows the food particles to pass posteriorly to the esophagus instead of the larynx. And the other thing I was just thinking about is the glottis. So you'll see I think the study hints, I'll ask you to know what the epiglottis is and what its function is. And also glottis. The glottis is just the opening. This opening here is called the glottis. The opening into the larynx is the glottis. Okay? And the larynx, so the main things to know about the larynx is that it's made up of cartilage, a lot of different cartilages. Thyroid cartilage, cricoid cartilage, and there's others, the retinoid cartilage. So just know that the larynx is predominantly made of cartilage and that it is the location of our vocal cords. Okay, so I don't notice too many people with Adam's apples anymore. They stick out. Have you ever seen those? Adam's apples that stick way out. So that is caused by the cartilage on the larynx. So that's how you know where that is. You can kind of palpate and feel it, that first hard part. And notice when you swallow, that goes up. Notice it feels like something goes up. And really, we learned that the epiglottis folds down, but it's also that the trachea pushes upward to cover the opening, the glottis. So it's not as much of the epiglottis folding as it is the trachea pushing up to cover the opening into the larynx. So it's kind of a mix of both of those things. And I just thought about that when I swallow. When you swallow, that's what's going up. And that's the purpose of that. All right, so the vocal cords aid in speech. The trachea, so speaking of cartilage, the trachea also has cartilage, but it has cartilage rings, and they're more C-shaped or horseshoe-shaped rings. They don't go all the way around to the posterior side of the trachea. Any idea why that is? So opening at back for expansion during swallowing. So if you remember the location here of the esophagus, where's the esophagus in relation to the trachea? It's posterior, right? So here's the esophagus. Imagine you swallow something and it's going through the esophagus. You have the trachea here, and the cartilage, cartilage is pretty hard, so it's not going to bend very readily if we swallow a big chunk of a Big Mac, right? So why would we not want the tracheal cartilage to go all the way around? Y'all get what I'm asking? Yeah. So when you swallow, if there was cartilage that went all the way around here, right, so the esophagus would not be able to expand and food would kind of get stuck in the esophagus. Does that make sense? So when you swallow kind of a big chunk. The esophagus is going to expand to allow that big chunk of Big Mac to get through. If the cartilage went all the way around, we wouldn't have any room to expand. So a nice little design there, I must say. All right, the bronchi has, so the bronchi and bronchus, what's the difference? Bronchi, bronchus. Huh? Bronchi, bronchus. Singular and plural. So bronchi is plural. That means two or more, right? Bronchus means one. So if we're just talking about one, we call it a bronchus. So the left bronchus or the right bronchus. We're talking about both of them. You use bronchi. So the trachea divides into two primary bronchi that enter the lungs. The secondary bronchi, actually let me go to this slide here. So the lungs are divided into lobes, and you all had that on the exam the other day. So notice the difference between the left lung and the right lung. You all should know that for the test. So how are they different? Okay, which? So the right one. So the right lung has 3 lobes, and the left lung has 2 lobes. What's another difference? Okay, the fissures are different because they're different lobes, but also the shape. The cardiac impression is on which one? The left. Okay. You may see that on the test. And then remember back to 201 where you had to learn the parietal and visceral pleura. What's the difference between those? So there are 2 membranes, right? 2 types of membranes. What is the parietal pleura? Yes. Okay, so the visceral, remember, is the membrane closest to the organ that actually covers the organ. And the parietal membranes line the cavity. So we have the pleural cavity, which is a space, and it's lined with parietal pleura. The visceral pleura, what does the word visceral mean? Visceral. Right, organs, internal organs of the ventral body cavity. So your lungs are viscera, your stomach, your intestines, your heart, internal organs. So visceral pleura is the membrane that covers the organ. And then the space between the two is called the pleural space. Okay, so again, let's go back to the structure of the lungs and how the lungs are supplied with the air, So the lungs are divided into lobes. Lobes are divided into segments, and then segments are further divided into smaller lobules. And this is just showing you which bronchi actually provide air to which of the segments. Okay, so the secondary bronchi supply the lobes, the individual lobes of each lung. The tertiary bronchi supplies the segments, the smaller segments. And then the tiny bronchioles supply the lobules. Now, so the difference, I think you all were trying to tell me the difference between bronchi and bronchioles is similar to the difference between arteries and arterioles, right? So they get smaller as you get closer to the lungs. Okay, so the bronchioles are smaller in diameter and they deliver directly to the lungs, the alveoli. All right, and the alveoli are so important because that is the area of the lungs that actually has gas exchange occur. So the alveoli are these little pockets, air pockets, and oxygen enters there. And notice the alveoli just have one layer of cells. And why would that be important? Why wouldn't you want 10 layers of cells in the alveoli? Remember, that's where gas exchange occurs at the alveoli. Too many layers, right, for oxygen to have to diffuse across. Okay, so it's oxygen is here. Notice here the capillaries that are surrounding the alveoli. So oxygen that is here inside the alveolus will diffuse into the blood capillary. And CO2 that is in the blood capillary easily just diffuses across into the capillaries, the alveoli. Okay. Okay, mention that. All right. So this part is kind of important. We'll definitely test you all on your understanding of ventilation, pulmonary ventilation, and the process of inhalation and exhalation. So what I want you all to understand is what is it that causes us to inhale and what is it that causes us to exhale. Most importantly, what is it that the diaphragm is doing in both of those instances? Okay. So, which is occurring during inhalation? So when you inhale, so where is the diaphragm? Right, so it's just below your thoracic cavity. It's between your thoracic and abdominal, right? So just below your rib cage. And it's dome shaped when it's relaxed, right? So kind of a dome, okay, or arched. So when it contracts, well, what happens to it when it contracts? It's no longer dome shaped, it flattens out, right? So it flattens out, it pulls down, okay? You all may need to write that down. When the diaphragm contracts, it flattens. It goes from dome-shaped to flat. So that means it pulls downward. Okay, so what is the diaphragm doing during exhalation? Right, there you go. So during exhalation, the diaphragm goes back to relaxation, and that means it goes back up. And one way to help you remember that, with me anyway, is what we're talking about is movement of air into the chest cavity and out of the chest cavity. So which of those movements will make more space in the chest cavity? Moving the diaphragm down or up? So when you move the diaphragm down, that makes more space for air to come into. Right? So that's kind of the easy way to think it through, because I'm sure later on you'll see questions on tests all the time about the inhalation and exhalation. So the diaphragm moves downward, causing air to come in, moves upward, causing air to go out during exhalation. Okay, so there are some other things that happen. So to really understand the dynamics, you need to have an idea of the relationship between volume and pressure. And there's a difference if you're talking about volume and pressure in reference to liquids, right? Like blood. Blood volume, anytime you increase blood volume, what happens to blood pressure? It increases. Okay, anytime you decrease blood volume, you decrease blood pressure. Always remember that. When we're talking about space, though, just an open space, there's a difference. The two do not go in the same direction, they go opposite. Okay, so volume and pressure are inversely proportional, which means they go in opposite directions if we're talking about space. Okay, and this is really the dynamic that is going on in the process of breathing. And one easy way to help you all understand that, I brought a little syringe here. And if you all have ever played with a syringe, you'll notice something. So when you pull, what happens to the volume inside? It increases. Okay? Now, let's just say you have it open right about here, and then you cover it and pull. So you're increasing volume, right, in the chamber. So I'm talking about the space here. The volume of space is being increased. But what is happening to the pressure inside? It's decreasing. Okay? The reason this is important is because air moves from high pressure to low pressure. Okay, so if you increase the volume, if my finger is not on there, anytime I increase the volume, air is coming into there because there's high pressure out here and lower pressure here. Okay, so by increasing the volume inside of the container, I'm decreasing the pressure in there. So that allows the high pressure out here to flow inward. So what's happening here? So why, when I pull on it and let go, why does it come back? Why does it come back on its own? Whereas if I'm not holding it, it doesn't come back. What is a vacuum? Very good. Right, so a vacuum is created when you have high pressure versus low pressure. So by increasing the volume, you have low pressure. So wherever there's a less pressure, that creates a vacuum. So it's going to pull air into that area. Okay? So the key here, though, is if you increase the volume, you're decreasing pressure inside there. So air is trying to get into there. So when I let go, air just flies in. That's the same way the lungs work. So in order for us to be able to breathe, the air in the atmosphere, or for us to inhale, the air in the atmosphere has to be higher, have a higher pressure than the air within our lungs. Does that make sense? If the air in the atmosphere is exactly the same as the air in our lungs, no air will move in or out. Y'all get that? So important to understand that. Now, that explains why when the diaphragm moves down, what is that doing to the volume or space within my chest cavity? It's increasing the space in my chest cavity. Anytime you increase the space, what is that doing to pressure in your chest cavity? It decreases the pressure in my chest cavity. So since the atmospheric pressure is staying the same, and I've decreased the pressure in my chest cavity, the atmospheric pressure is higher, so it's going to pull air into where there's less pressure. Okay? So that's why whoever designed the body made the diaphragm pull down to make there more space for air to come in. Also, the rib cage does something as well. When you inhale, the rib cage expands, right? Take a deep breath and feel what happens to your rib cage. So all of that is creating what? More space, more volume, which is decreasing the pressure. Okay? It's a little weird to think about, but that's exactly what's happening. So we have to have all those mechanisms. And we tend to think that we're breathing. Our breathing causes the contraction of the diaphragm. But the diaphragm moving is what causes us to breathe. What is it that causes, you all remember recently, I guess, when they have big sales going on at supermarkets, people get crushed, and some of them die. Why do they die? Why y'all laugh at that? Huh? Think about that. So I think up in New York, a bunch of people were trying to get into Walmart, and they got trapped right there in the entrance. Yeah, it's Black Friday, exactly. So, so what? No, really though. So what causes people to die because they're scrunched in like that? Why can't they breathe? The diaphragm can't contract. The diaphragm can contract. The rib cage. So if you're squeezed so tight, your rib cage is not going to expand enough for volume and pressure to change. So remember, the only way air comes into your lungs is if there's less pressure within your lungs. So you have to create that by making your rib cage expand. Okay? So it's very difficult to breathe. I know sometimes kids try to fake like they're not alive, sometimes just playing, but you see their stomach and things going up and down. Exactly.
So when you fall, when you're not younger, you fall and get your breath over, what makes you lose your breath?
It just pushes all the air out. It kind of just forces it all out.
So, okay, like if you're riding in the car and you're going through fast and you let the window down real quick and air rushes in, what causes you to lose breath? That same thing?
It's pretty much the same thing. So a differential in pressure. Okay. All right. All right, so gas exchange. Another key point here is that the reason that oxygen and CO2 are able to be exchanged across the capillaries in the lungs is because of the difference in concentration. Yes.
You have to have more pressure on the outside or to be able to breathe.
Yes. So just like, think diffusion. What allows for diffusion? There has to be high concentration one area than another. And that's what we're talking about here. When oxygen diffuses from the lungs into the blood, the only reason it does so, if you look at the picture up at the top, is because there's a higher concentration of oxygen in the lungs than there is in the blood. If it was not there, if there was no concentration difference, oxygen would not come into the lungs, okay, from the lungs. Okay, same with air. The only way air is going to come into our lungs is if the pressure outside of the body is higher than the intrapulmonary pressure, the pressure within our lungs. Okay? In fact, I have a picture of that too. This picture. So notice the pressure of the air, the atmosphere doesn't change. We can't do too much to change the atmospheric pressure. Okay? So the pressure outside of your body is going to stay 760 millimeters of mercury. So what we have to do is have a way to make our internal pressure change. Okay? So at rest, when we're not breathing, the pressure inside of our lungs and outside in the atmosphere is the same. So no air is moving. Here, what's going on? So the outside pressure is 760, but we have decreased the intrapulmonary pressure. The pressure within our lungs has decreased. How? How did we decrease that? How do we decrease the pressure within our lungs? By changing the volume, remember? Changing the volume. No, that's what causes inhalation. This is what causes inhalation when there's higher pressure outside than inside. My question is, how do we get the pressure in our lungs to change from 760 to 758? No. Volume. Changing the volume changes the pressure. That's why I put this up here. So when you increase the volume, the space within your lungs, your chest cavity, that automatically changes the pressure. Okay, that's why I did this whole thing. Changing the volume makes the inside of there have a lower pressure. Right? Y'all with me?
No.
Yeah. Exactly. And this is the part you all need to get, so pay attention. Okay? The only thing the body can do to change internal pressure is by changing volume. Okay? Just like here in this syringe. You can increase the amount of volume or space in your chest cavity by pushing the diaphragm down. Yes, that's what we're talking about. So volume and space, that's what we're talking about. So volume, so when you push the diaphragm down, doesn't that make more space in your chest cavity? So anytime you make more space in your chest cavity, that automatically decreases pressure.
Decreases pressure in the lung?
Yes. Yes. Okay? It decreases the pressure within the lungs. Y'all got that much? Okay? So moving the diaphragm out of the way makes more space. Anytime you make more space, that's an increase in volume, which means it's a decrease in pressure. Okay? So all of that has to happen in order for your pressure to decrease below that of the atmospheric pressure. So when that happens, that's when you inhale. You only inhale when you have increased the volume and decreased the pressure within your chest. So again, if you're being squeezed too tight, you're not increasing what? Volume, so you're not changing the pressure. You're not decreasing pressure. So this has to happen for you to inhale. Okay, what about how do we exhale? The only reason we exhale is if we have a higher pressure in our chest cavity than we do in the atmosphere. So how does our body make that happen? Right, by decreasing the space, the volume in our chest cavity. How does that happen? How do we decrease the pressure? Decrease the space. When the diaphragm goes back up, it pushes and decreases the amount of space. And anytime you decrease space, that increases pressure. Okay, so we increase the pressure enough that air is going to be forced out of the lungs instead of in. So that's how expiration occurs. Lung volume decreases, pressure rises above atmospheric pressure. Okay? Hey, and I had a difficult time understanding this when I was in school too. You just have to go through it a few times. And it'll come. All right, so gas exchange follows the same rules as diffusion. Oxygen is going to move from an area where there's what? Higher oxygen concentration to an area where there's a lower oxygen concentration. And you can see that up in the lungs. So in the alveoli, at the very top, you see there's a lot more oxygen than there is in the capillaries. So that's what drives oxygen to move into the capillaries, and vice versa. Okay. Most of the oxygen, so we've talked about how oxygen is transported. Most of it is bound to hemoglobin. Carbon dioxide, on the other hand, some of it is transported by hemoglobin, about 10%. Most of the CO2, though, is going to be dissolved in the blood plasma. And this reaction you will see going forward. And so what happens is the CO2, where does the CO2 come from again? From the body cells, right? During the formation of ATP. So the cells release CO2 into the bloodstream. And when CO2 gets in the blood, it combines with water to form carbonic acid. And then carbonic acid ionizes out to hydrogen ions and bicarbonate ion. Bicarbonate ion is a buffer, a blood buffer, and its job is to make sure that the blood pH doesn't shift too far one way or the other. Now, the reason I put this on here, this kind of helps explain why CO2 makes blood acidic, because it converts to carbonic acid, which is an acid, and then it breaks back down. But instead of just knowing all the, understanding all the reactions and what they do, the key thing here is to understand if we're not exhaling enough, then we have a buildup of CO2 in our blood. Whenever we have a buildup of CO2 in our blood, that makes our blood acidic. Okay? Even though CO2 is not an acid itself, if there's too much in our blood becomes acidic. The pH drops. Okay? So if you all were to sit here and hold your breath as long as you could, your blood pH would drop slightly. Okay? Why? Because you're not blowing off CO2 fast enough. On the flip side of that, if you just sit here and breathe really rapidly, as fast as you can, your blood pH is going to do what? Your pH is going to increase. This room? When? Probably about 30 minutes. Okay. So that's key, and that's something you all need to remember. Yeah.
What causes the hiccups, like when you have hyperventilating or something like that?
Not sure. I don't know the mechanism.
Yeah, I've heard about that. When you have the hiccups, and it's like you drink a lot of water.
Right. I don't think I've ever come across across an answer for what the real causes are for hiccups. I'm not sure. But I have heard some of the remedies, whether they work or not, all the time. You said drink a lot of water.
No, you drink a lot of water, but it doesn't solve it, and then they say hyperventilated, and it's like one of the remedies.
Well, yeah, and I've heard that if you hold your breath and then drink water.
Yeah.
Yeah, it's another one that you breathe in and out of a bag, Yeah, bring
Okay.
kind of balance.
Have you tried that? Or
Yeah, I tried it one time.
did it work?
I had that problem one time. Yeah.
So it worked?
It did work. Yeah, it does work.
Okay.
Yeah.
What, breathing into the bag?
Yeah.
So then,
And you look at it, it's like,
Yeah.
you look it up, you say, you just stop, listen to something.
Right.
It
And
says
I've heard
you're-
some
it
of
says
that.
you're hyperventilating.
right.
So
I'm
I
not
just-
sure of the mechanism, though. That's
Yeah.
interesting, though. I've never heard of that one.
Yeah.
Mm-hmm. Here we go with all these questions. Use it to get oxygen. Bring in more oxygen. Yeah.
Like, you see one person, you're not even sleepy, and then like you see them yarn, you start. It just says
I don't know. Okay. Let's go to that hyperventilation, though. I did have. I thought I did. Yeah. So, accumulation of CO2. So when you hear of hyperventilation, so what that means is a person is what? Breathing hyper fast, faster than normal. So what is that doing to CO2 levels in your blood? Right. So if you're breathing fast, you're blowing off CO2 very rapidly. And what did we say about CO2? If you get rid of it, it makes the blood less acidic, right? Because you're getting rid of it. So CO2, think of it as acid, even though it's not an acid. But the more you have, the more acidic your blood. The less you have, the least acidic. So if you're blowing off CO2 too fast, your blood becomes more acidic, which means the pH is going which way? Up or down? Down, right? So if you're getting rid of CO2, your blood pH is going up, right? Up means basic, right? So pH is below 7. 1 to 7 is acidic. 7 to 14, pH is what? Basic. So, what is the normal blood pH? 7.35 to 7.45. That's normal blood pH. Okay? So, on the testify, say something like a person is hyperventilating, which would most likely be their blood pH. And I have a list, and I say 7.0, 7.8, going up or down. You kind of have to think about that, right? So if they're hyperventilating, they're getting rid of CO2, which means their blood is becoming more or less acidic. Becoming less acidic, so less acidic is going toward, is going up. Okay? So remember, acidic is low pH. So you all need to remember that. So hyperventilation causes low CO2 levels in blood. That is called hypocapnia. Hypocapnia causes an increase in blood pH. So the blood becomes alkaline, more basic. And hypoventilation means what? The CO2 It's staying in the blood, so it's making the blood what? It's making the blood more acidic. So what is that doing to the pH? It's lowering the blood pH. And slight changes to blood pH can be fatal. So that causes decrease in blood pH because CO2 remains within the blood. One other thing to think about here while I'm on here, have you heard of acidosis, like diabetic acidosis? So one of the consequences of diabetes mellitus, remember, is that blood sugar stays high because the sugar is not going into the body cells. So what the cells do is start using fats for fuel to make ATP. And during the process of breaking down fats, the body produces keto acids, or a type of acid. And when that gets into the blood, it lowers the pH of blood. So one of the mechanisms of having that increase in keto acids is the body tries to hyperventilate. Think about that for a second. So one of the compensations, so if a person is suffering from acidosis, one of the homeostasis mechanisms is the body goes into hyperventilation. So think to yourself, why would a person being acidotic, why would the body want to go into hyperventilation? So if they have the diabetes and they're having diabetic acidosis, the pH is what? Their pH is dropping, right? So the body's mechanism to get the pH back up to 7.35, one of the things it could do, we have buffers which help out, but after a while you run out of buffers. So the only other thing the body can do in that regard to change pH is what? CO2, something about CO2. What do we say about CO2? CO2 also makes the blood acidic. So what would you need to do with CO2 to reduce the acidity of blood? Release it. So hopefully that makes sense to you. If a person is in a state of diabetic acidosis, ketoacidosis, you may see the patient hyperventilating because the body is trying to get their pH back to normal by releasing acid some other kind of way. Over whose face? No, I'm specifically talking about diabetics. Not everyone. Some people need that because they're not getting oxygen in. Those are two separate things. Not necessarily. So that's just how the body is working. I remember taking my son to the doctor, and there was another kid there, and he was just sitting there, but he was breathing so fast, you know. And I thought about that. I wonder if he was going through that diabetic acidosis. And a few minutes later, we were back in the back, and we heard an ambulance. And the nurse said the ambulance came to get that kid because he was in a state of diabetic acidosis. And I kind of recognized that. So I kind of want you all to be able to think through some things like that. All right. Let's see if there's anything else major. I think that was about it. And partial pressures. I know, so usually when we're talking about gases, they're not given in terms of concentration like moles per liter. They're given in terms of millimeters of mercury. That's how pressure is measured. And so when you see this P, PO2 and PCO2, those are called partial pressures. Nothing to get too worked up about, but the partial pressures are just determined by the concentration of each gas there is in the atmosphere. So nitrogen has the largest concentration in the atmosphere. So these are just the comparison, in comparison what we have out there. But in terms of controlling whether oxygen and CO2 comes in or out, again, that is based strictly on what? Concentration difference. So if the PO2 of oxygen is 104 in the alveoli and 40 in the blood, which way is oxygen going to move? From high to low. So it's the same. So when you're looking at gases, just think it's the same. Everything moves from high concentration to low. Okay? Alrighty. And these are spirometer measurements. Capacities, just the amount of air that can fill the lungs. I think that's about it.